Hello and welcome to today's special video on rheumatoid arthritis, or RA. Whether you're someone living with RA, a caregiver, or someone who is simply looking to understand this condition better, you're in the right place. In this video, we will take you on a deep dive into what RA is, how it affects the body, and the most effective ways to manage the disease and lead a fulfilling life. Over the next few hours, we'll answer many of the key questions you may have about RA, discuss treatment options, and share real-life stories from people who live with it daily. So, let's get started. Rheumatoid arthritis is not just about joint pain. It is an autoimmune disease that can affect your entire body. It can impact the joints, but it can also affect the skin, eyes, lungs, and even your heart. In fact, RA is one of the most common autoimmune diseases, with more than 1.3 million people affected in the United States alone. But how does RA affect the body, and what makes it so different from other types of arthritis? In today's video, we'll explore all these aspects and more. We'll break things down into manageable sections. So by the end of the video, you'll have a comprehensive understanding of this complex disease. Let's start with the basics. What exactly is rheumatoid arthritis? RA is an autoimmune disease that causes the body's immune system to attack its own healthy tissues, specifically targeting the synovium. The synovium is the lining of the joints, which helps to lubricate and nourish them. In a healthy joint, the synovium produces fluid to keep the joint moving smoothly. However, in people with RA, the immune system mistakenly targets this lining, causing it to become inflamed. This leads to pain, swelling, stiffness, and eventual damage to the cartilage and bones within the joint. Unlike osteoarthritis, which is caused by wear and tear, rheumatoid arthritis is a chronic condition that involves systemic inflammation. This means that even though it primarily affects the joints, it can also lead to complications in other organs of the body, such as the lungs, eyes, and even the cardiovascular system. That's why it's important not to just treat the symptoms of RA, but to also address the underlying autoimmune component. Now that we understand what RA is, let's look into the causes. Unfortunately, the exact cause of rheumatoid arthritis is still not fully understood. However, researchers believe it arises from a combination of genetic and environmental factors. Certain genetic factors are thought to predispose individuals to developing RA. The most notable of these is the HLA-DR4 gene, which is part of a group of genes involved in regulating the immune system. This gene is found in a higher percentage of people with RA compared to the general population. However, not everyone with the gene develops RA, suggesting that other factors are at play. Even if you have this gene, it doesn't guarantee you will get RA, but it certainly increases your risk. Having a family member with RA also increases your chances of developing the disease, suggesting a strong genetic link. While genetics play a significant role, environmental factors are often the triggers that set RA in motion. Infections, particularly viral infections, have been linked to the onset of RA. One virus in particular, the Epstein-Barr virus, EBV, has been implicated in triggering RA in individuals who are genetically predisposed. Other environmental triggers include smoking, which is strongly associated with RA, especially in people who carry the genetic markers for the disease. Smokers are at a much higher risk of developing RA, and their symptoms tend to be more severe. Air pollution, obesity, and even high levels of stress can also increase the risk of developing RA. It's a combination of factors that lead to the development of RA, which is why the disease manifests differently in each person. It's also worth noting that RA is more common in women than in men. In fact, about 75% of people diagnosed with RA are women. Hormonal changes, especially during pregnancy and menopause, may contribute to this gender difference, as estrogen can influence the immune system's activity. So the onset of RA is influenced by both your genetic makeup and various environmental factors, and these factors interact with each other in ways that we are still studying. Now let's dive into the symptoms of rheumatoid arthritis. RA can present in various ways, and the symptoms can range from mild to severe. It's crucial to recognize these symptoms early so that treatment can begin as soon as possible. 1. Joint symptoms. The most common and characteristic symptoms of RA are joint pain, swelling, and stiffness. People with RA typically experience inflammation in the smaller joints first, particularly in the hands, wrists, and feet. Morning stiffness is another hallmark of RA. Many people with RA find that they have difficulty moving their joints after waking up, and it can take 30 minutes or longer to feel more flexible. This stiffness can persist throughout the day and become more intense during flare-ups. 2. Systemic symptoms. Unlike osteoarthritis, which primarily affects the joints, RA is a systemic condition, meaning it can affect other parts of the body. In addition to joint pain, people with RA may experience fatigue, fever, weight loss, and a general feeling of being unwell, often referred to as malaise. People with RA may also experience rheumatoid nodules, firm lumps that form under the skin near the affected joints. These nodules are usually painless, but can sometimes become inflamed or infected. 3. Symmetrical joint involvement. RA is typically symmetrical, meaning it affects joints on both sides of the body equally. For example, if you experience pain in your left wrist, you may also experience pain in your right wrist. 4. Flare-ups and remission. Flare-ups are common in RA and can be triggered by a variety of factors like stress, infections, or changes in the weather. During a flare-up, symptoms worsen and joints become more swollen and painful. These flare-ups can last for days or weeks, but the intensity may decrease as the disease goes into remission. Diagnosing RA can be a challenge because its symptoms overlap with those of many other conditions. A thorough medical history, physical examination, and a combination of tests are used to diagnose RA. 1. Blood tests. One of the first steps in diagnosing RA is blood tests. Tests for rheumatoid factor, RF, and anti-citrullonated protein antibodies, ACPA, are commonly used. These antibodies are present in most people with RA, although they are not exclusive to the disease. However, not everyone with RA will test positive for these antibodies, and some people without RA may test positive. So these tests are just part of the diagnostic picture. 2. Imaging tests. Imaging tests, such as X-rays, MRIs, and ultrasounds, are used to detect joint damage and inflammation. X-rays can show signs of joint erosion and cartilage damage, while MRIs and ultrasounds provide a more detailed view of soft tissue inflammation. Your doctor may also perform a physical exam to check for joint swelling, tenderness, and range of motion. This helps to evaluate how the disease is affecting your body. Now let's talk about the treatment options for RA. While there is no cure for RA, modern treatments can help control the disease, alleviate symptoms, and slow joint damage. 1. Medications. The first line of treatment for RA involves medications. Let's look at the most common categories of drugs used to manage RA. A. Disease-modifying anti-rheumatic drugs, DMARDs. DMARDs are the cornerstone of RA treatment. These medications aim to slow the progression of the disease and prevent further joint damage. Methotrexate is one of the most widely prescribed DMARDs and works by suppressing the immune system's activity. Other DMARDs include leflunomide, sulfasalazine, and hydroxychloroquine. These drugs can have side effects, but they're vital in managing the long-term effects of RA. B. Biologic response modifiers. Biologics are a newer class of drugs that target specific parts of the immune system. They're often prescribed for people whose RA hasn't responded well to traditional DMARDs. TNF inhibitors such as Humira and Enbrel are some of the most common biologics. Biologics are often administered via injection or infusion and can be very effective at reducing inflammation and preventing joint damage. C. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs like ibuprofen can help reduce inflammation and relieve pain, but they don't slow the progression of the disease. They are often used in conjunction with DMARDs or biologics to manage symptoms during flare-ups. 1. Physical therapy and occupational therapy. Physical therapy is another key component of RA treatment. A physical therapist can guide you through exercises that improve flexibility, strength, and overall joint function. An occupational therapist can also help you learn how to modify daily tasks and use assistive devices to reduce strain on your joints. 3. Surgery. In severe cases of RA, surgery may be necessary to repair or replace damaged joints. Joint replacement surgery is common for people with RA who have significant damage to their knees, hips, or shoulders. Living with RA can be difficult, but with the right tools and strategies, it's possible to manage the disease and maintain a high quality of life. 1. Diet and nutrition. Your diet plays a huge role in managing RA. Anti-inflammatory foods such as fish rich in omega-3 fatty acids, leafy greens and nuts can help reduce joint inflammation. Avoiding processed foods and sugars may also help manage RA symptoms. Maintaining a healthy weight is also important to reduce the strain on your joints. 2. Stress management. Stress can trigger flare-ups, so it's important to learn effective stress management techniques. Yoga, meditation, and deep breathing exercises can all help reduce stress levels. 3. Mental health. Living with a chronic condition can take a toll on your mental health. It's essential to seek support from friends, family, or a counselor if you're feeling overwhelmed or depressed. Joining support groups, whether online or in person, can also provide a sense of community. Thank you so much for joining us in this comprehensive video about rheumatoid arthritis. We've covered a lot of ground today, from the causes, symptoms, and diagnosis to treatment options and strategies for living well with RA. While RA is a complex and challenging disease, it's important to know that with the right treatment plan, lifestyle adjustments, and support, you can continue to live a fulfilling life. Stay informed, stay connected with your healthcare provider, and remember, you are not alone in this journey. If you enjoyed this video, don't forget to give it a thumbs up, share it with your friends, and subscribe to our channel for more helpful content. Hit the bell icon so you never miss an update. Thanks for watching.